I think we are coming to the end of the successful symposium. So it was, very informative, very contentful, very thoughtful. And we had a very tight, jam-packed session, but still, the amount of information and, knowledge which had flown through the past 4 hours was very, motivating myself. We thought it as a global symposium. So at least for one continent, we had one presenter. We had from South America, we had one presenter from Africa, and then from India, and then we had Dr. Jens from Europe. So we could say that this is a global symposium. Thank you all for that. And so before some 3 or 4 months, when I first contacted Tamara and Chris, and so the initial idea was I was very much interested to start a kind of a social science platform, and then especially for TB, my interest was towards, of course, it is the interest of my institute also. I was very much interested for, interventions for addressing the MDR tuberculosis in India. So what I feel is that there is, we have clinical regimens, we have a lot of clinical research which is going on for TB and MDR TB. So the amount of, the resources, the amount of attention which is given for MDR TB on its biomedical aspects is not reflecting on the social aspect of MDR TB. So we always treat the social aspect of MDR TB equal to the drug sensitive TB, except for the counseling part. The amount of money which is, out of pocket expenditure, the amount of side effects, and the magnitude of the psychosocial problems was so vast. So I was interested that we should have a very specific group which works on the MDR TB. That was the idea with which I approached Sonar before some 3 or 4 months. And another thing was, I was interested about that vaccination related, studies, because right now NIRT is also conducting a vaccine trial. COVID is coming up with vaccine. I couldn't find a lot of, groups are working for, vaccine related barriers or gaps kind of. So it was in that idea that informal conversation started. And then Dr. Tamara and Chris, everyone suggested, let us have a, kind of a platform where we could exchange, you bring up your partners, we will bring up our partners, we will have our thought exchanges. So then we will have an idea of what we are all working actually. So this symposium was successful in that aspect. Right now we are introduced. We have a lot of other partners. We have TB Alert, whom we are working with. We have a lot of NGOs. We have a lot of other government institutes. So they will be roped into this platform in further months. So this is a wonderful first step. I really thank Sonar, and I really thank our collaborator KHPT and everyone for making this a successful first step. Our immediate objectives have been attained, I feel. So just I want to put my thoughts very shortly in 2 minutes. How could we take forward this? So we could develop, like I told, TB is 44%, almost 50% of the TB is accumulated in Southeast Asia. 1/4 of the burden is here. So if we are not going to address it very, very aggressively in this area, we will not be able to attain even the global challenges. We should have some kind of, a platform. I would like to repeat the mission statement of Sonar Global. It should be a sustainable network. That is what I feel it is very important. A sustainable network of social researchers or researchers who are interested in social science, who will have the commitment, who will have the shared values to take forward the social science driven research in a mission mode. Because it is so disheartening to see that there was a lot of motivation, a lot of work which has been done till last year, but this COVID has created a kind of a barrier. Our objectives, as per the modeling, as per the notification data which we are getting, is going to be delayed. And then the social determinants of low and middle income countries, the suggestions say it is going to exacerbate, it is going to amplify the the socioeconomic barriers also. So I think it is a timely thing to have this kind of a network or a hub for social science researchers and interventionists who work towards TB. So I think there will not be a difference of opinion in this. So, and the next one is the some of the important works this network would do is, one thing is research. So last week when I had a meeting with our director, and even my HOD conveyed that, okay, so far whatever has been done in social science for TB has been very tangential. We should do something which which have the impact, which will impact the national TB program. We should do something very systematically, very rigorously at a large scale for the national TB elimination program. So I think such a kind of network, of international and national experts will provide us the opportunity to create some large-scale studies, multicentric studies within states of India or even other countries with the partners we have. I think if global clinical trials are happening, qualitative research and socioeconomic researches are very contextual. We cannot go for a global trial. That may be an argument, but still I feel that we could have large scale trials which could be able to produce or show the evidences for impact across different settings. That will actually reduce duplication of what we are doing. I'm very happy to see that there is a tool for pediatric counseling. I'm very happy to see there is a longitudinal study for stigma conducted by Union. I'm very happy to see symptomic approach. I am very happy to see that visual ethnography to a method which was shared based thing. So these things are done in silos. This platform, brings us, if it brings us together, we can mobilize our resources. We have very meager resources. This could be placed appropriately. We can learn very quickly from each other, and then we can move forward fastly. I think that is the need for social research, to avoid duplication, to mobilize our resources and move and work in a smart way. So that will be one objective. Apart from research, we can also, Sonar has emerged as a very good resource for, COVID-related and other infectious disease-related materials, training materials, guidelines, and community engagement, materials kind of things. So this training and, other capacity building related things could be taken up, because one of the problem with India in social sciences, we don't have much of a contextual, kind of tools for assessing the except for the economic component. Even for alcohol related behavior, if you want to check, we always keep relying on audit scale. We don't know actually how far it is fit for the Indian population. There are a lot of the tool related, method related things which we could be benefited from experts from Sonar. That is one aspect. And then we could always go for large scale interventions. Now the national, even today we had a meeting with our respected director. So there are a lot of things which has been said already in a national strategic plan. So what we need is more of an implementation, research. And implementation research is primarily qualitative, and it deals with the social and economic determinants. So implementation and operational research to address the gaps and to scale up the whatever the evidences will be another avenue this proposed our network could address. So basically research, interventions, as well as training and capacity building, and we could mobilize ourselves around this as quickly as possible. And I'm very happy, my director has been supporting me a lot right from the beginning for this thing, and she has also assured that this should sustain, this should continue. So these are all my thoughts and way forward for this particular symposium along with Sonar and our members. Now I ask Dr. Tamara to just give her valuable feedbacks and go ahead for this symposium. Thank you.
Okay, thank you very much, Dr. Curry. I think what I just want to say to you and all of the presenters today is that it's been really, really enlightening and inspiring to see the kind of work that you've done in India and elsewhere too. And I would also sort of preface my remarks with, personally, I've never conducted research on tuberculosis, but it reminds me a lot of the work that I and others have done on viral hepatitis, namely hepatitis B and C, and some of the challenges that people. Can you hear me? Because I think my screen is frozen. Okay, good. That some of the challenges that vulnerable populations face in even getting a diagnosis, and the ways in which a diagnosis can really shatter certain kinds of social relations, on the challenges of patient-centered treatment and the broad range of care, the longer social and economic consequences of living with these diseases. So there's a great deal, I think, that sounds to a certain extent familiar, even though these illnesses are not the same. And what I particularly appreciated was the kind of grounded and grounded up approaches that all of the presenters seem to bring to this work, both in the realm of research and in the realm of research action, which I think is particularly important. Uh, One of the things that I guess I was going to ask initially as a question, but also just kind of throw out there as a thought is, well, first of all, it seems
Yeah, Tamara got cut.
No, it's mute. Muted.
Tamara? Chris, any idea?
Yeah, I asked her to unmute. Tamara, in case you can hear us, we don't hear you anymore. She said she already chatted to me before and said that she'd had problems with the connection.
Okay.
Let's see if it comes back.
Yeah.
Because she was in full flow.
Yeah.
Let me just
wait.
I'll just quickly send a. Well, there's no response to the chat. Let's have a look.
Okay. So meanwhile, while we are waiting, can we get our opinion from our Professor Jens?
Thank you. Yes, I think it's been a wonderful symposium. It's been extremely rich in terms of especially patient-based perspectives, which is really key to this field. And so it's been both very enlightening and very interesting to listen to. I think your comment just before, Dr. Kari, about avoiding duplication of efforts is well taken. Now, of course, for those of us with experience working in India, it's a huge country, it's a subcontinent, and I guess to some extent there has to be duplication of efforts because it's just so big that it's impossible to know everything that's going on. But it would be really fantastic to have some kind of platform where these experiences and successful interventions could be put together for shared information. And I see Tamara is back, so I'll quickly start. Thank you.
Yes, Tamara.
I'm really sorry about that. I don't know what happened. I just keep getting kicked out. So I'll go very quickly because I didn't want to cut off Jens there. But first of all, I think that we could learn a lot from you. So that's what I wanted to say, that you have a lot of experience doing this kind of work that that I think would be really valuable for you to contribute your experiences on a much more, I think, global scale, to look beyond India, even though I recognize that this is a priority, but I think that there are a number of other um, members and partners who could learn from your experiences, both in the domain of tuberculosis as well as in other kinds of infectious diseases or diseases with, kind of syndemic impact. The second point that I wanted to just make was one of the things that it seemed to me that is needed is perhaps the type of advocacy for the social sciences on multiple levels. So I wanted to ask you, on what level do you think that that's most effective and most in the service of your needs? I think Dr. Karuna's really moving presentation underscored a kind of remarkable and important first step, looking at or the ways in which the insights into stigmatization were transformed into a national strategy document. So I think one of the things that could be really productive for all of us is working in collaboration with NIRT for a broader recognition of the contributions of multidisciplinary social sciences and action. And so I was thinking about how we could facilitate exchanges between your experiences and your researchers and elsewhere. Finally, I just want to point out that one of the tools that I think you mentioned is a kind of vulnerability assessment and community engagement approach. And I think, Dr. Curry, you heard the other day of some experiences that different partners are having in working with this tool. We often think in new circumstances that we know who's vulnerable in certain situations. And I think one of the uh, sort of powerful dimensions of that particular tool is that it works to try to understand the what I would call the conjugation of different sorts of factors that produce vulnerabilities and identifies hidden forms of vulnerabilities that may not be initially evident either to certain kinds of stakeholders and actors. And that sort of process, that qualitative study, we are trying to scale up to larger data sets to try to not only take account of the rich qualitative ethnographic work, data and analysis that we collect and produce, but also to link it to uh, other kinds of data sets that may be more quantitative, because I think, as you know, one of the first questions that we're asked as qualitative researchers is, okay, this is all very interesting, but how representative of it, of a population is it? And we often get stymied because I think we're very much attached to, and rightfully so, to these qualitative approaches. But we need to be able to explain to stakeholders, okay, so how widespread is this? And that those feed into various kinds of communications activities. So maybe that's something that may or may not be useful to our within the context of NIRT and your collaborators within India, but it's just throwing something out there. So I'll stop there and let other people jump in.
Okay. So thank you, Tamara. Thank you for that inputs. I know, can I ask Dr. Karthikeyan to put few words about your experiences and thoughts? Yeah.
Thank you, Karikalan, and thank you, Dr. Chris and Tamara. It is a good learning. As I want to reflect on what Director NIRT mentioned in today's her opening remarks. We should continue to have to work as a group to take this forward and make this as a strong advocacy part for social sciences in TB program, which in India, Government of India is looking into social sciences, social component into TB program. But if we can join hands together and collaborate in a meaningful way much more, we can reach greater heights to benefit our patients. That is excellent. We should not stop here. We should take it forward to greater heights. And our team, I think the team is ready to do that. Thank you. Thank you.
Thank you, sir. Thank you very much. Dr. Karna, quickly. Yeah.
Thank you again to all the organizers and Dr. Karikalan for inviting me for this wonderful session. I really enjoyed all the presentations, and we can see that there is so much in common, yet we need to bring this more streamlined so that it can be more beneficial. I would like to suggest to Dr. Tamara and others that Union conducts an annual conference on TB and lung diseases. So this year also I mean, basically because of COVID, we have this as a virtual conference, but I would really like to see, I would like to moderate a symposium on this aspect, because we had done a symposium on prevention 2 years back, and it was very important where we brought in other social aspects and social determinants also into the prevention aspect. And I would like to see if we could present a symposium, propose a symposium in the conference as part of this group, and then take it forward from there. Also have a group where we can design studies together in the context, local context of each, and we lack cohort studies in this area. So that would be very interesting to see, because social aspects or social behaviors are something which have long-term impacts. We may not be able to see short-term impacts in a short term. So that these three things are my suggestions. One is to have a symposium in the conference. Another is to build a research network, and we design cohort studies, long-term cohort studies to show the social impact on TB.
Yeah.
Thank you.
That is a very valid point. You know, lack of cohort or longitudinal data is one of the important problems. Thank you, Dr. Karna. Dr. Aparna is here.
Yes, Dr. Karikalan.
Yeah, if you
Yes,
want
hi.
to quickly, you can 1 or 2 words. Yeah.
Yes, thank you so much for this opportunity, Sonar and NIRT, and all participants. It was amazing. I just wanted to say that, yes, as suggested by my previous presenters, I would like to add in that if we could practically, implement like a task force wherein, we now from this day onwards, like we take it forward and we actually brainstorm together about some, practical implementations of our vulnerable communities, how to focus, then bring together the other organizations who would not be a part of this today, but we are working together with them in our own contexts. So that would be really nice, and we could have some frequent regular meetings in which we then are able to see that what we are able to do practically and what are the challenges we face. I think that would be really helpful too.
Thank you, Dr. Aparna. I request Dr. Muniani sir to just put the last few words.
So again, this is now we are in NIRT in the situation do or die. So Government of India is already committed, Prime Minister of India, India to reach the goal 2025 per TB elimination. So given responsibility, it's the only national institute working on TB researches, ICMR-NIRT. So we have a everyday meeting, what to do. Now we don't have, for me, my personal, no time to do research. We have enough research. 2025 is another 4 years. How we can reach that target? So now this platform, we need, I think, I requested Karihalan to continue this forum and get the ideas for the implementation to achieve the target. You can do a lot of research, no problem. But now we have like, again, this Health Minister of India is the chairman for chair of the Stop TB, WHO Stop TB Forum, Health Ministry. And again, DG ICMR again given responsibility. COVID will go very fast. COVID can be another 6 months, 1 year. But TB is a very long time it's spending here. How we can eliminate, eradicate, what to do. So now we have in our head, they are asking so much research done. Give me the evidence what to do. Now no time, like now we are, another responsibility is taken this Department of Health Economics, Health Technology Assessment. Tell me which can be implemented, where we have to invest. No time, quickly, another 3 months time, you tell me the impact or another impact analysis, which intervention will reduce more cases, how we can achieve the detect and treat policy, how we can achieve the more treatment outcome, how we can prevent more cases. Can we go for chemoprophylaxis, or can we go for vaccine, or can we go for active case finding door to door and detect and treat? Or we don't know. Otherwise, in the beginning, when I joined, people used to tell that the developed countries, they will take the TB patient, put them in jail and treat them and send them out. Like some very, he already mentioned, very, what is that? Drastic mission mode, we have to take the policies. That's why this forum, if you provide, already in NIRT, we have a very big departments, clinical trials going on, vaccine trial is going on, bacteriology, they are doing it for new diagnostic tools, biochemistry is going on, drug observation. Then our responsibility, again, this I agree with Dr. Jens Seberg, biosocial models, which developed countries shown there is a reduction due to the biosocial interventions. That contribution. Otherwise, this clinical trial and all, it will take another 10 years to complete. Now we are going for another quick trials, the global trials to implement, like shortening the treatment for MDR-TB. Very fast stream. They have implemented 6 to 9 months regimen. Again, they are changing the policies very fast. The only program in India changing policy very fast and quick is a TB control program. This can be the best model for other infectious disease control program. So I request this forum to give ideas and provide inputs how we can achieve these 2025 targets. Thank you so much.
So that also applies for if India is able to achieve the TB elimination goal somehow, then that also is an example. If India could achieve, the rest of the world could follow. So that is common for all the high burden TB countries. So thank you, Tamra, Dr. Karthikeyan, Karuna, and Aparna, and Dr. Jens. and my HOD for providing, valuable inputs about the way forward. I think we are already, 17 minutes past, So thing is, so this session is actually recorded. We are audio recorded. Everything is available. So based on all the inputs, maybe with the help of Chris, we could create maybe a 1 or 2 page of summary outcome of the report, of the entire program, and then we could circulate with all the participants. So we will be keep in touch. We have all the registration addresses, and then we have, of course, have all the contact details of all the presenters. We could be in touch in some other way as suggested by my director, either through online mode or some other way that I will work out with Dr. Christopher. So I think we are final. We are final with the wrap-up session. So thank you. Now I will give my Chris. Anything you want to add?
No, I was just going to say that, yeah, I mean, I agree completely. And, Sonar Global is a, we have a platform that we can use. We have a website that we can take advantage of. We can, use that as a way of communicating amongst members, sharing information. Again, Jen's already talked about having a platform for people to share, research and findings on. That's exactly what we're here for and what we're trying to build. But we can support in a number of ways. I'm looking forward to moving forward with that.
Yeah. Thank you, Chris. Thank you, Chris. So now I will move to the vote of thanks. It will take 2 minutes. So thank you very much for stakeholders from both ICMR and Sonar side. Especially, I would like to thank my director for providing the support to conduct this challenging symposium. There are a lot of steps which I have to cross to get the permission and everything. So I got her full support, and then was able to do that. And also, I would like to thank the stakeholders from Sonar, Dr. Chris, Dr. Tamara, Dr. Joy, and Karlijin. So they have been patient enough. Actually, this symposium was planned on the lines of World TB Day, but that couldn't happen. Still, we were able to work out that, and then we were able to successfully do it. So in terms of numbers and participation and response, I think this is a very big success. We had 150 registrations actually, and then the highest participation today, it came around 80 plus. We might be counting for 90 with the presenters here in this room. So that is almost 2/3 of strike rate we had. And then, though questions were less, I think, the points which has been raised, even minimal points were very valuable. So I would like to thank all the presenters from Sonar side as well as from the Indian side. Thank you for your participation. I would like to thank all the staff members, my staff members who have coordinated this event. Thank you all very much. And I would like to thank all the participants, who have registered for the symposium. I may not know your name. Thank you everyone. And then we have Sonar website is available in the invitation. You can just contact anyone. I am in that network. My email ID is there. I have also displayed my email ID here. We have the email ID of Dr. Christopher and Tamara. So anyone is at freedom to, contact us or for any other further questions or classifications. So that is the thing. Thank you so much. Thank you so much. It has taken 20 minutes extra, but I think it was productive. Thank you, Christopher. Thank you all. Thank you very much. So we will be updating with a summary, maybe a 1 or 2 way report, and then we will share with everyone.